Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over the best standing sciatica pain relief exercises. Just a couple quick notes before we start. Each one of these exercises works differently. They're going to target different causes of sciatica and different ways to be able to take tension and pressure off the nerve. To get the best results, go through all the exercises and use what gives you the most relief. Next being, while doing these exercises, we want to see what is called centralization of symptoms. In a nutshell, when you put pressure onto the sciatic nerve, it causes pain to travel further into the leg. When you take that pressure off, it does the opposite. It comes back out of the leg. So when you do these exercises, if you notice less pain in the leg, that's a good thing. Keep up with that exercise because it's helping, but if you notice more pain in the leg with that exercise, please discontinue immediately. With that being said, let's get started. So if you're dealing with a lot of sciatica pain right now, these are two exercises that I would start off with. They really complement each other well and they can give very quick relief. The first one is called the standing bridge. This one is going to help release tightness across our lower back and pelvic floor, taking that tension and pressure off the sciatic nerve. To be able to do this one, we're going to place our whole backside flush against a wall or a door. Put your feet out in front of you too, that way you can lean your body weight into the wall or the door for support. My feet are roughly hip width apart and I like to place all of my body weight more towards my heels during this exercise. The next thing that I do is just relax my body as much as I can. I don't try to tense it too much. Again, we're trying to release tension, not create it. So let's take our hands, put them right on our hips. What you're going to do is slowly drive your belly button and hips forward like this, lifting your butt off the wall. As you do this, you're going to feel a light activation of the muscles in the core, your back, your butt, your legs. Just go for a light activation of these muscles and not to the point of any pain or discomfort. If you start to feel any discomfort, back off slightly. And at this point, you're going to hold it for about 5 to 10 seconds and just do nice, slow, controlled breathing. Let out as much tension as you can. You're going to relax and then you're going to repeat this 5 to 10 times. And with each repetition, try to build into it just a little bit more. Afterwards, see how you feel. If this is really helping out, you're more than welcome to throw in another set or two. But let's take this one to the next level and focus on a deeper stretch that's also going to help take a lot of tension and pressure off a bulging or herniated disc, the main cause of sciatica. This one is called the wall lean. Again, all we're going to need is a wall or a door for this one. The hardest part about this exercise is just knowing which side to place closest to the wall or the door. So remember, good or non-painful side will be closest to the wall. I'm going to demonstrate what to do if you have left-sided sciatica. We're going to start with our feet together, spaced roughly a foot, foot and a half away from that wall. We're going to then lean our body weight into it to the point where our shoulder and elbow are flush against it. Make sure that your shoulder does not lift off during this exercise. You want no space. Instead, all movement is going to come through our lower back and through our hips. We're going to take our hand, place it right on our hip, and now slowly press your hips towards the wall. As you do this, you're going to feel a really good stretch form in the lower back. Just go to the point where it is a deep but comfortable stretch. Hold this for 20 to 30 seconds, and during that time period, do nice, slow, controlled breathing. You're going to release it and then repeat this 3 to 5 times. And with each repetition, try to build into it just a little bit more. To get even a deeper stretch, all you have to do is space your feet further away from the wall, because at that point, the further your feet are away from that wall, the deeper this will become. So this exercise is called standing back extension, or the movement of going backward. Extension helps open up the back a little bit more, taking pressure off a bulging or herniated disc. Again, the main cause of sciatica. So the easiest way to be able to do this is to take your hands and your thumbs and start right around your belt line. Take your thumbs and press right into the muscles off to the side of the spine and just cup around your hips. Now press forward with your hands and your thumbs while leaning backward with your shoulders at the same time. Keep building into this until you feel a deep but comfortable stretch in your lower back. You're now going to hold this for 5 seconds and then release it. On the next repetition, take your hands up just a little bit more, maybe about an inch or two, and then repeat. You're going to notice it opens up the back just a little bit differently. So repeat this the whole length of the lower back. As you do this, you're going to find that one certain spot, like right here for me, just offers the most relief. At that point, we're going to stop over that spot and now press into it and lean backward as much as we can, but hold it for longer. Do this for about 20 to 30 seconds now and do nice, slow, controlled breathing. Release it and then repeat this 3 to 5 times. If you would like to take this one to the next level though, you can do the towel aided stretch. This one's a little bit deeper, so you're just going to need a large rolled up bath towel and you're just going to place it right over that spot that we found earlier. Just grab the two ends and then pull them forward as much as you can to create initial tension. And then what we're going to do, keep pulling forward with the ends and lean backward at the same time. The towel's really going to help open up that spot in the back just a little bit more. And when I do this one too, I experiment with pulling the towel straight forward, but also angling it up like this and pulling it more towards the ceiling. You're going to find that so-called sweet spot after a while that offers the most relief. So just keep building into that, holding this for about 20 to 30 seconds, releasing it and repeating this about 3 to 5 times, or to the point where you're not getting any more improvement. This exercise is called the step back, and it's going to help target a major overlooked cause of sciatic-like pain, which is called deep gluteal syndrome or piriformis syndrome. This is where the muscles around the buttocks start to spasm, compress the nearby sciatic nerve, causing pain down the leg. So to be able to release these tight muscles, this is what we can do. We're going to start in a wide scissored stance like this with the painful side towards the back. Try to get into as much of a scissored stance as possible, and if this is the first time doing it, I would recommend going next to a wall or at least having something sturdy that you can grab onto for support in case you lose your balance. But what we want to do next is take this front foot and turn it inward as much as we can until we feel a light stretch forming across our hip, and then we're going to do the same thing with this back foot. From here, we're going to lean backward, placing all of our body weight onto this back heel. At this point, you should feel a deep stretch forming across the buttocks on this back leg. But this is how we're going to take it to the next level and get a much deeper stretch. We're going to put our arms out in front of us, cross them over, kind of like a genie position, and now we're going to turn through our waist and rotate our body towards this back side. So build into this one slowly, because I really feel it across my glutes right here. It's almost like a really deep stretch into your hip. Hold this comfortably for about 20 to 30 seconds, release it, take a breather, and then repeat this 3 to 5 times. And with each repetition, try to build into it just a little bit more. Afterwards, see how you feel. If it's helping out, but there's still some tightness left, you're more than welcome to repeat this over and over again until everything is nice and loose, or you're not getting any more improvement. And for a good measure, even if the other side doesn't hurt, I would switch to the other side and throw a couple repetitions in just to help keep everything nice and loose. This is a standing sciatic nerve floss, which is going to help take tension off the whole sciatic nerve pathway as it travels through the leg towards the foot. The first movement, we're going to go right next to a step or a stair and place the painful side's heel right up on that step. And I would do this next to a wall also, that way you can grab onto it for support if needed. But we want our leg nice and straight, also our back nice and straight with this one. The first movement is what I call the gas pedal. So just take your foot and imagine pressing into a gas pedal as much as you can. As you do this, you're going to feel a really good activation of your calf muscles that works upward towards your thigh, even towards your hip. Build into this one as much as you can, not to the point of pain or discomfort, and then you're going to hold this for a second or two, release it, and then bring your foot back towards you as much as you can. Again, you're going to notice a really good activation of the muscles across the leg, but it hits it a little bit differently. Hold this for a second or two, release it, and then it's a nice fluid movement. You're going to go forward and backward as much as you can for 10 to 15 repetitions. With each repetition, just keep building into it more and more. So at this point, you should feel a lot of warmth coming into the leg. That's increased blood flow and circulation, but more importantly, the muscles should start to feel like they're loosening up. So let's progress into a little bit deeper of a stretch. What I'm going to do this time around is add in a head movement that mimics my foot movement. So let's press back into our gas pedal, but as we do this, we're going to slowly lower our head downward towards our chest at the same time. You'll notice it hits those muscles a little bit more right here in the leg. Hold this for a second or two, release it, bring your foot back towards you, but this time around, look upward towards the ceiling at the same time. A nice fluid movement, of going forward and backward like this for 10 to 15 repetitions. So if you really want to take this one to the next level, you can do what is called a slump stretch, and this one is going to be by far the deepest of these three stretches. So the first thing that I'm going to do is bring my foot back towards me as much as I can until I have a lot of tension being built up in my leg, especially over the back of the thigh, over the hamstrings. We're going to hold this and now slump forward, taking our chin towards our chest, rounding our upper back and shoulders forward, lowering our chest towards the floor. The more that you lower your chest towards the floor, the much deeper this stretch gets. Only go to the point where it's deep but comfortable. Hold this for about 5 seconds, release it, and then repeat this 5 to 10 times. But go through all of those movements and progress into them as much as you can. This exercise is going to focus on a deep opening stretch in the lower back known as traction that can quickly take pressure off a bulging or herniated disc. For this one, we just need to go next to a wall or a door. So let's start facing it and get pretty close to it. The first thing that we're going to do is just take our hands and reach overhead as much as we can. And during this exercise, treat your hands like suction cups so they're stuck to the wall or the door and they don't slide like this. Instead, all movement is going to come through our legs. What I'd like to do next is have my feet a little bit wider than my hips, and then I place all of my body weight onto my heels. Just slightly bend your knees, and at this point, squat your bottom down and away from the door. The more that you lower your butt towards the floor, kind of like a sitting motion, the more that you're going to feel a deep opening stretch in your back. Just go to the point where it's deep but comfortable, and then hold this for about 10 to 15 seconds, release it, and then repeat this about 5 times. And with each repetition, try to build into it just a little bit more. If you would like to take this one to the next level, what you can do is slowly tilt your upper body towards one side. So I'm just kind of leaning a little bit towards my left, and then I'm going to sit or squat straight down towards the floor. You're going to notice it opens up the back a little bit differently. So give that a try towards the left and also towards the right. If any of those positions offer more relief, at that point, throw more repetitions in. So here's another really good traction exercise, but this time around, we're going to let gravity do all of the hard work for us. You're going to need something sturdy enough that will support your body weight that's also roughly hip level. So something like a desk, table, countertop, those should all work. What we want to do first is get really close to that object, to the point where your thighs are pretty much flush up against its edge, and just take your hands and grip right off to the side. What I'm going to do next is bend my knees and place all of my body weight right onto the balls of my feet. At this point, you just want your whole body to relax and let gravity pull all of your body weight straight down towards the floor. You're going to feel a deep opening stretch in your lower back, and it usually feels really good. So build into this one as much as you can, and then hold this comfortably for 20 to 30 seconds. But if you do have the arm strength, try to hold this position for even longer, upward towards a minute or 2. The longer that you're in this position, the more pressure will be taken off a bulging or herniated disc. And I definitely recommend nice, slow, controlled breathing too while doing this. Just let out as much tension as you can. When you do need to take a breather though, step back up like this, take one. But try to do this for at least 3 to 5 minutes, broken up into as many repetitions as you like. So to take this one to the next level and focus on movements that will open up the back a little bit more, you can start to swing your hips from side to side, kind of like a pendulum. So swing them towards the left and also towards the right. Try to build into this movement. You may find that one certain position, like swinging towards the left, just offers a lot of relief. And you may find going towards the right actually causes pain. So what you want to focus on are the movements that are offering more relief, and at that point building into them more and more until everything is nice and loose, or you're not getting any more improvement. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.